Right. So all of you take your notebook and write 1, 2, 3, 4, 5, 6, like that. 5 sets. Five sets. Right. So I have given you the points. And we are discussing these points. మెడిసిన్స్ తీసుకురావాలి.
పొద్దున్నే రావాలంటే ఏం చేయాలి? ఫ్లిప్కార్ట్ పొద్దున్నే రావాలంటే డెలివరీ ఏం చేయాలి? వెంటనే ఎప్పుడు దొరుకుతుంది స్లాట్స్? అంటే అర్జెంట్ ఇప్పుడు వెంటనే తెప్పించుకోవాలి. ఎక్స్ట్రా ఎక్స్ట్రా పెడతా. ఎక్స్ప్రెస్ 94 inch. 5 inch का जरूरत है. Thank you.
Okay, now we are going, this is called fast track reading. Fast track reading, we are just waiting for 2-3 more students. So 14 of them, right? So fast track reading, what do you mean by fast track reading? Fast track reading means not reading at all, it is studying. It's focusing the main part. So that you have to. Okay. Part B. Okay. Question number 1. Right. So here it is. Okay. So instruction manual, digital automatic blood pressure monitor. Fine. This is it. Now we have the question number 1. Yes. So Mhm. Yes. Right. This is the question number 1. Okay. Question number 1. Pause the screen. Yeah. Yes, this is question number 1. A, B, C. 3 options are there here. So just think about this one. Think about this one, how it is. This is just for a reference idea I have given you. Don't write your answer anywhere because I'll take you to a different platform. Yes. So next one, what you have to do is study the questions carefully. Because more than the questions, I'll explain you what is the problem. Yes. So I'm taking you there. Just hold on for a second. Resume screen. So, right. Reading. Fine. So here it is. Right. Okay, this is fine. So 630 students have answered these questions. Okay. This is the fine. Now I am giving you the link for this one. Okay. So this is the link for this one. So you can just go through them. This is the first question. Okay. Copy. Right. This is our channel. Okay. Cannot transfer from here. Okay. Right. So, classical corrections. Yeah. I'm showing it from the other area. Yes, you got it here. So that is it. So this is reading part B. Reading part B. Yes. And right. That's it. So there you are going to get all the points. Carry it forward. Yes, there you are. This is the first question in your Telegram channel. Copy, sorry. So here it is. So copy post link. Yes. This is post link. And this is group link. Copy message link. Yes. Now there, A, B, or C. You can click on either A or B or C, and you'll get the answer there. You'll get the answer there. So that is the question. You have 1 minute to take the answers, and you have already gone through that one. So now I'll tell you to submit your response here. 7, 6, 5, 4, 3, 2, 1, and submit. Submit your response. Write down your answer here. Okay, one student has written 2. What about the rest? Come on, quick. We are going to do 30 questions now. So now what I'm asking you, okay, after you answer these questions, so 6 students have answered so far. So 1, 2, 3, 4, 5, 6. 6 students have answered so far. So how do you want me to go with this? So shall we do the test first? Shall we do the test first and then solve the answers? Okay, discuss the answers, not solve the answers. First, you will solve the answers and then discuss the answers, or discuss, solve first and then discuss immediately. So which one you prefer? First solve all the 30 questions and then discuss the 30 questions, or then and there we'll finish with the question and go ahead. What do you want to say? So first option is question, first one is, so there are two options here. Number one is first solve all questions, okay, and then discuss. That is the first option. Then option number two is discuss. So, okay, solve and discuss one question, each question, okay, immediately. So which one do you prefer, one or two? So which do you prefer, one or two? Any one option, you can write one or two. Majority count. Come on, fast. That depends on your options. So Amen, count how many twos are there. And Smita, count how many ones are there. Amen, count how many twos are there. And Smita, count how many ones are there. So based on that one, we'll go ahead. Yeah. Amen says that there are 6 two numbers and one. Smita says one, number one. Okay. So that means we'll go according to the majority vote, that is one after another. Immediately we'll solve and then only we'll move ahead. First we'll solve, then we can identify our ability. Okay, anyhow, you are identifying your ability, that you are writing in your notebook. You are writing in your notebook only. Right, you are already identifying your ability because you are getting the answers there directly. Okay, so you are getting the answers directly here itself, A, B, C. Click here and you will get the answer. There itself you are getting the answer, so no need to worry. So write in your notebook, okay, 1, 2, 3, 4, 5, 6. Then we'll check how many marks you are getting. Now coming to the point, let us discuss this question. This is a super fast shot of explanation. So now the manual informs us, means tells us about information. What information is it providing? Manual is providing what sort of information? Informs us about what? About the blood monitor, blood pressure monitor. It's providing information. What sort of information it is providing? So here you see, right? The points are very clear. The first one is related to is likely to interfere. So that means it is interference. Interference with others means unnecessarily involving with others. Is talking about interference. Is likely to interfere. Next one is may not work correctly. So it is talking about work. It is talking about work. And third one should be considered safe. It is talking about safety. So is it about interference with other equipment or work, work style or safety? What it is talking, you see. So if you see, you can see very clearly. Now here, this may result. So he's talking about the result. So this may result means consequence of using a blood pressure monitor. So he's talking about the impact result, final result. So this may result in incorrect operation. Operation means work. Operation means work. Just jump in there. Just jump ahead. So operation means work. That's it. Operation means work. Operation means work. Operation means work. This may result in incorrect operation. That's it. That is it. So clear as that. So simple as that. Now you have to identify this part here. Now be very clear. Now how are we going to check this one now? All the other related words you have to check now. So not, work correctly, not work correctly, not work correctly, correct. Not means incorrect means not correct. So incorrect means not correct. Incorrect means not correct. So here you see the answer. Answer will be everywhere. Okay, answer will be everywhere. So in incorrect operation, that's why he says here. He says here, you see here. This medical device for both, care should be taken to avoid. So he's taking to avoid the use of monitor within 7 meters of cell phones. 7 meters of cell phones. Cell phones are not medical equipment. Cell phones are electronic equipment or other devices. Okay, or other devices. So this is other medical equipment. So this is medical equipment. He's not talking just about medical equipment. Okay, and this is all environments. And this is only about other devices. So here, you can see here, other devices. Other devices. Other devices is here. And this is all devices include other devices and medical devices. And this is only medical. Only medical. So only medical is wrong because it is not only medical. All devices. All devices means medical devices and other devices. So this is also ruled out. So A and C are ruled out. Is not talking about medical devices and all devices. Is talking about other devices, right? Cell phones are other devices other than medical. So first one is medical, second one is non-medical, third one is medical and non-medical devices. So that is how you go. So may not work correctly in close proximity to some other devices. So he's telling it's generating strong electrical and electromagnetic fields. So you have to be careful. So this is how you can see incorrect operation means not work properly. And then the other word is may. Other word is may. And the other word is may here. Proximity. Proximity means closeness within 7 meters of range. So that is it. So all these are not necessary, but still I am showing you. 7 meters, within 7 meters means proximity, means closeness. Other devices, cell phones are other devices, some other devices, some other devices, cell phones. So you can see everything is leading here only. Everything, okay, of the medical device. This may result in incorrect operation of the medical device. Okay, so electromagnetic interference. So try to understand this one. portable electronic devices. Here also it is there. Portable electronic devices, other devices. With the increased use of portable electronic devices, medical equipment may. So this is medical equipment. Those are other than medical equipments. You can understand very clearly. So everywhere the answer is there in the first line, answer is there in the second line, answer is there in the third, fourth lines, and last line also it is there. Okay. So nevertheless, care should be taken. Why care? Because it is not safe. Okay. But he's not talking about all. So here, see here, this is medical, this is non-medical, and this is medical plus non-medical. So medical is ruled out. So here also medical is there. So that is also ruled out. So only non-medical. So may not work correctly in close proximity to some devices such as cell phones and other devices. That is very clear. So hide floating. Yeah. So may not work up. So he's talking about operation. That is very clear. Operation and incorrect operation. That is directly in B. B is talking about work. A is talking about interference. C is talking about safety. It is unsafe, but not in all environments. In some environments, medical environments is okay, but electromagnetic environments is not. So safe only, it is safe, but not always safe. All environments, it's not safe. Some environments, it's safe. It's safe, definitely, but it's unsafe also in many environments, many places. Okay, fine. So that's it. So it is talking only about operation, and operation means work. So you have to know the synonyms of these things. Then only it will be easy for you to understand. Okay, print a screen. Right. So I'm providing the explanation here. Ooh. Okay. Yes. Right. And now again, you can see there very clearly. Now, okay. Do you get the clarification? Clarity. Okay. So if it is yes, we'll move ahead. If it is no, then you can ask me your doubts so that we can move forward, clear the doubts. If it is yes, so you say yes. If it is no, then ask why you say no. So Sanjana, what is the confusion for you there? You have to write there. Okay, no problem. Anybody can write yes or no or all right or whatever it is. If you have any questions, then I will check here and I'll call you and you have to ask me what is your problem. Then I'll explain you. Fine. So Sanjana, you can unmute now. Sanjana, you can unmute. Oppo, please write your name. Please write your name. Okay. Rename. Please rename. Rename. Okay. Right. Yes, Sanjana, tell me what is your confusion?
Sir, I cleared my confusion. I understood. I
You
understood, sir.
understood? You are sure? Don't hesitate to ask me, no problem. Some people are not asking, doesn't mean that we should not ask. You can always ask. I'm there for everyone, okay?
No, sir, I understood.
Yes,
Clear,
yes,
clear.
yes, no problem, no problem. Okay then. So first question is clear. Then, right. Okay. Now we are moving to the second question. So first question is done. Now we are moving to the second question. I am sending the second question now. So second question. Reading part B. Yes. Question number 2. Yes. Right. Second question has come now. This is the second question. And you can immediately tick here ABC afterwards. Okay. So copy post link. Yeah, here is the post link. And copy. Yes, this link. Message link. Message link is also there. Okay. Now I have given you. So you can go there and you can, once you are ready with the answers. Right. Now you have 2 minutes for this. You have 2 minutes for this. Huh. Yes. Hope you got your answers. Submit your response. Question 2. Question 2. Yes, 5, 4, 3, 2, 1, and submit your response. Right. So you have given the answers. Very good. So you already know the answer, but why and how? Now let us see. The notice is giving information about. The notice is giving information about. About what? About something. Information about something. Information about something. What information is it giving? What information is it giving? That is a point there. So what information? Information related to what? Information related to what? Information related to checking. So checking. Okay. How the use of NG feeding tubes is authorized. Authorization. Which staff should perform NG tube placement? Staff. So now here, these are the important points. Information regarding checking or information regarding authorization or information regarding staff. So try to understand very clearly. The notice is giving information about. Now, if you see here, in the center, take the center, go to the central part. If you see 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12 lines. So if it is 12 lines, Take the sixth line. So leave 1, 2, 3, 4, 5, sixth line. So here, sixth line. So sixth line is very important. So there the paragraph starts here. The paragraph starts here. So there, you see there. The paragraph is starting here. Okay. Paragraph is starting here. This sentence is starting here, sorry. Insertion. From here, it is starting, going on till the next line, next line, next line, till here. Someone competent. So competent. Competent means fit person. Competent. Competent. Okay, competent. When he is competent, if he has undergone training, practical training, trained person. So all these things are showing you there. So now insertion and care of an NG tube should therefore be carried out by someone. By whom? By a doctor or a nurse. Okay, by a registered doctor, not just a doctor, registered doctor. If his name is registered, that means he is authorized. If his name is not registered and he is just practicing, no. A nurse, registered nurse, and who has undergone theoretical and practical training and is deemed competent, not only doctor and nurse, but he's even competent. That means he's not insane. Okay, deemed competent, fit, or is supervised by someone competent. They themselves are doing, or they are at least supervising. So now here, who is this? Is it just checking? Is it just authorization? So now you have to understand there. So these people are the staffs. Nurse is a staff member. So nurse is a staff, and doctor is also a staff member. Okay. Which staff? Either a nurse or a doctor. Either a nurse or a doctor, not a pharmacist. Okay. Not some other person. A doctor or a nurse. A doctor or a nurse. Try to understand here. And that doctor should be a registered doctor, registered in the government, official registration. Then they should have undergone theoretical and practical knowledge, training, and is deemed competent. Even after all these things, they should be competent, fit, not drunk, not insane, not mad, not sleepy, competent when he's doing that one. And if he is not competent, at least by someone who is competent. Okay. After training, not just without training. The person who is supervising or doing, either he is doing straight away or he is supervising somebody who is doing. That is important. Anybody can fit, but at least somebody who is competent should be supervising whether he is fitting correctly. He should check that. That is what it is. So it is talking about staff. It is talking about staff. Insertion should be done under the supervision, should be carried out by them or under their supervision. So that is what it is. Which staff should perform NG tube placement? That is, you have to be very clear with that one. Right. So now here, be very clear there. Right. Now let us see the point in there. It's so simple. So information related to just checking. Is it just checking? Or is it authorization? Or is it staff? Staff. Which staff? Particular staff. So that is the point. So simple as that. So easy as that. Okay. Now, so second question. So most of you have written C. That's quite clear. Now it's, so one word you have to find out which is the biggest word, especially, or the most important word. Either you have to see the biggest word or the most important word. Here the most important word is staff. Okay, right. Height floating. Yeah. So that is the clarity of the subject. You should know in the central part. Go to the central part. Directly jump to the central part. Save your time. Okay. So that is the explanation given. Right. So, fine. So you got the options here. Second question. Now, the question again for you. Is the concept clear? If it is yes, type yes. If it is no, type no, so that we can move forward. If it is no, we can get clarity. If anybody has any doubts, you can ask me there. Come on, fast, fast, fast. Just 15 seconds only. Okay. Just say yes or no. Fine. So many students said yes and nobody said no. So we are moving to the next question. Okay. Next question. Clear all drawings. Okay. We are moving to the next question. So I'm sending the third question into the picture. Yes. Here we go. The third question. Yeah, that's it. The third question has come now. This is the third question. Right. The third question. Copy, post a link. Then message link. Okay, that's it. Once you are ready, then you can go there, click on the link, you can go there and you can tick the answer there. You have 2 minutes again. Right. So now question number 3. Question 3. Right. Don't type the answer until I tell you. So submit your response. 5, 4, 3, 2, 1. Submit. Okay. Now let us get the clarification for this. So how are we supposed to clear this? What must all staff involved in the transfusion process do? So what is the action? What is the action? What must they do? What must they do? So what must all staff involved in the transfusion do? What must they do? Must do. Must do means mandatory. Must means mandatory. Mandatory means make sure. Must do. Ensure, make sure, mandatory, compulsory. Okay. These are the words you can use. So the word is mandatory. Mandatory. Okay. Mandatory. Now you understand here. All staff are responsible for ensuring that they attend the mandatory training identified for their roles. Okay. Mandatory training for their roles. Okay. Now here, staff must ensure that if they take any part in their competency assessment is updated every 3 years. Updated, that is what it is. Updated, this mandatory training. So it should be updated every 3 years. This training is valid for 3 years. Validity period of this training is 3 years. Before that 3 years is completed, they have to go for again another training. So every 3 years, this training they should attend. That is what it is. That means they should see that they will be within this 3-year period. If it is beyond 3 period, that means they are invalid. They are not competent. They are not competent. So that means he is talking about the validity period, validity period here. So staff must ensure that if they take part in the transfusion process, their competency assessment is updated every 3 years. That means this is only valid for 3 years. The period is valid for 3 years. So it is just a validity. So that's it. Validity is here. Still means at this particular point of time, still valid. So training validity, that is the point. Are they within these 3 years or not? That is what they have to check. Okay, valid period. So check that their existing training period is valid or not. That's what he's telling there. Okay. Be very clear there. Oh, what happened? Okay. Only one has gone on. Okay. Okay, that is video. Okay, fine. So here it is very clear for you now. So check that. Right. Yeah. Training. Okay. Updated every 3 years. That means valid. So that's it. So check means ensure. Existing means current. That they attend all staff are take any part. Their competence is updated every 3 years. So for their roles means existing work. So now try to understand how it is pointing it out. So this is the way how you have to understand. Once every 3 years, they should go for the training because it expires. The validity expires. So validity is important. Before expiry, they should go for the training again. That's the point. So all of you have written that, but I hope you understood the clarity of the point there. So your mind should think like this, not just finding the answer. Your mind should question. Always question the question to master the question. Question the question to master the question. That is important here. Is the concept, sorry. Is the concept clear? Say yes or no. If it is a yes, it's a yes. If it is a no, then we'll think about it and we'll know why it is. Anybody has any doubts, you can say no, no problem. You are free to ask, okay? You are free to ask. I'm there for every single student. Okay, fine. So now we are going to move to the fourth question. We are going to move to the fourth question, print a screen. So simple as that. So that's the point. Okay, fine. So that is the third question. Clear drawings. Okay, fine. Now we are moving to the fourth question. So I'm sending you the fourth question now. Third question is over. Question number 4. Question number 4 is here, coming. There it is. So question number 4. Yeah, this is question number 4. And this is the link, copy post link. And copy message link. So anywhere you can give the answer in these two options. So that is the question. You have 2 minutes. Do whatever you want. Yes. Now, question number, don't type and don't post until I tell you. Let everyone post together. Question 004. Okay, 5, 4, 3, 2, 1, and submit. Yes, all of you submit your answer, please. So you got B's all, very good. So now we are going to discuss this answer, why it is right, what are the easy strategies which we can follow, that I'm going to give you now. Now let us see. The guidelines establish that the healthcare professional should, the guidelines establish that healthcare professionals should do something. The healthcare professionals should do something. Right. Should. Okay. Should. Should. Now here, now see these areas, you see, don't go to this area now. Aim to make patients fully aware of their right. Awareness. Awareness of their right to a chaperone. Awareness, patients' awareness. So awareness, that means knowledge that they can have their chaperone. They can have their chaperone. Awareness, they should know that they can have. Okay, they have a right and they should know that they have this right. That is what is awareness, creating an awareness in the patients. That is number one. So healthcare professionals should inform them about their right to have a chaperone. Next one, evaluate the need. Need, this is the need for a chaperone. Need, if it is required or not. If it is required only, otherwise no need. So based on the need, this is based on the right. This is based on the need. Respect the wishes of the patient above everything. So wish, not right. This is the right given by somebody, the authority. But this is a wish without authority also. So patient's wish, patient's right, and patient's need. So awareness or need or wish. Wish means interest. Right means 100% guaranteed by constitution. Wish means if he is interested, he can, otherwise no need. Need, based on need, based on right. So awareness of their right. So this is their right. Which is important here, right or need or wish. So right by constitution, wish is personal, need is situation. Now healthcare professional, chaperone. So this is regarding chaperone. Fine. Right. Chaperone is everywhere. Fine, let us see here. Now, try to understand very clearly. It is there in every line. It is there in the beginning. It is there in the middle. It is there in the last also. Be very careful. Just very, very important. Now here, if you see, right. Now let us see here. Now here in the middle, you see here. Yeah. In the middle also it is there. In the end it is there. In the beginning it is there. Now let us see in the beginning. First part. Here. Question. Question means problem, means difficulty. So this is the question, this is the question, and this is the question. Related word is coming here. Question of using professional judgment. Judgment means you have to judge. That means you have to value. That means you have to evaluate. To assess. Assess means evaluate. Judgment to assess means evaluate. Assess means value. An individual situation. Situation means case. By patient. So on what basis? Situational basis. Case by case basis. Situational basis. So you understand that very clearly there. Okay. Right. So now it is on the base of a situation. If the doctor thinks, of the healthcare professional thinks that it is not needed, so no need. He has a right. But if problem persists, otherwise no need, na? Right? So you try to see there what it is talking about. Right? So now everything is very clearly present. Now a patient may specifically request a chaperone. It's a right for him. Or in certain circumstances, again here it is, I told you everywhere it will be there. Circumstances may nominate one. Circumstances means situation, again. Situation. Okay? But it will not always be the case that the chaperone is required. Required means needed. So needed, everywhere it is showing. Need. So here you see, I told you these are enough. If you can understand in the first line, that means you are a PhD candidate. You are an awesome person. You are the best candidate. You are getting the answer from the first line itself. From the second line you are getting, that means you are a postgraduate. Right. Okay. Now see here, circumstance. Circumstances. Circumstances means need, synonym. Sorry, circumstance means situation, basis. So first line, second line, and pointing these things. Okay, not always. Not always. Okay, next one. Required means needed. Required means needed. Okay. Required means needed. So in the first sentence. Okay. In the first sentence. And then it's a situation based. So all are pointing towards B. You can see there. Right? Is there? Right. So if a chaperone is offered and declined and he doesn't want, so that means he doesn't want, right? That is his wish. Okay. But according to need only, health professional can go ahead. So now you can see. Question means problem. Okay. The problem is based on necessity. Based on necessity. Right. Evaluate means assess. Judgment to assess or evaluate. So see, everything is pointing there only. Right. Everything is pointing there. So this is how you're going to analyze this particular question. Right. I'm not bothered whether anybody is there or not. I'm not even opening the microphones. I'm just teaching because I know that the answers will be clear. Even before you think of any doubts, I think what doubts will come to students. Okay. So I'll think from the student. Being a student, I will think. Then I will clear all the doubts for myself. Then I am ready here with you. So once I give the explanation, that means doubts are already taken into consideration. But in spite of that, still if there are any doubts beyond my reason, then you can definitely raise your hand and you can ask. What are these comments? Why they are commenting here? They can write here. No? Punita Franklin, Shalini Singh. Why are you keeping the answers open? Don't understand people. Okay, fine. Okay, right. ABC here it is given, but still they are running and answering outside the box. Oh. Right. So here it is the explanation. Hide. Okay. Clear all drawings. Okay. That is the explanation there. I have put there. Right. Next one we'll move to question number. Okay. This is question number 4. Any doubts? Hit your buttons. Yes or no? Yes or no? Amen. Faith has a question. Yeah, I'm coming. Amen. I'll give you a chance to unmute. Okay. Yes, amen. You can unmute.
Yes, sir.
Yeah, amen. 1 second. Let me put the question before you. Yeah, tell me amen.
Here in this case, two confusions might be, for me. One is I was confusing two options like B and C. First, after reading the first 3-4 lines, I understood okay, B was there. But again, I went down like the healthcare professional should wait until the chaperone has left the room. Means they are talking about wishes. So I was confused that how can I eliminate the C?
Okay, right. Now the guidelines establish that the healthcare professional should. He's talking about healthcare professional. Okay.
Yes, sir.
Right? His role there.
Yes.
So you are saying part C. Okay, let us see. Respect the wishes of the patient above all else. But if it is required and patient says don't want, when it is mandatory that some problem is there, there should be somebody to monitor. Otherwise, he will be blamed. You understand? See, for example, a drug addict is there.
Okay, sir.
Okay. Or a psycho is there. He is ready to kill you only, first of all.
Hmm.
Then he says, I don't want any witness, because in his mind he is already decided to kill the other person who is going to give treatment to him,
Mhm.
because he
Okay,
is a
sir.
psycho,
Hmm.
right? He says, I don't want a
Yes.
chaperone
Yes.
as a witness, but you need a chaperone for as a witness.
Okay.
You understand?
Ah. Yes.
Because maybe he is going to harm you, and if afterwards, if anybody is asking you what happened, there is no proof for you also.
Okay, sir.
You understand now?
Ah.
It is
But the
not
thing is,
always required that his wishes be sanctioned. Okay.
okay. But
And
here in that
he may
words,
say
they are
no.
not telling.
No. If a chaperone is offered and declined, this must be dearly documented in the patient's record along with any relevant discussion. But he's telling it is often a question of using professional judgment. The patient may say, no, I don't want. But still, you should decide whether a chaperone is needed or not. You understand?
Okay. Okay.
Maybe sometimes, they want to commit suicide also.
Okay.
Right?
Yes, sir.
They will do any sort of things, no? And what,
Okay.
so for
Yes.
example, he will commit suicide. When you are doing something here and there, that time before operation, you are doing something else. And you are trying to mix some tonics or injections or syringes. You are making preparation for the procedure. In that meantime, he will take the knife and cut his hand and cut his throat. Then what you will do? He will be ready to blame you or something else also. And he will die. You will be a problem, no?
Yes, sir.
So chaperone means an overseer, a person who is there to observe, okay, what is going on. You understand now?
Yes, sir.
So it is you have, so what is it telling? It is often means mostly a question of using professional judgment to assess an individual situation. That means it depends on situation. Okay.
Okay.
A patient may specifically request a chaperone, or in certain circumstances may nominate one, but it will not always be the case that a chaperone is required. Even if he asks, you need not give. That means where is his wish? In the first sentence itself, it is clear, right?
Yes. Yes.
So you are a postgraduate, you are a doctorate, your mind is very special. So you can understand that in the first sentence itself, it is ruled out.
Okay.
Why are you going till the last? That means if you are going till the last, that means you are a 10th class or 5th class girl. Your knowledge is limited. You understand what I'm telling you?
Yes, sir.
So the lower you are going, see, for example, a person is swimming. If he can swim, he will be on the surface. If he cannot swim, he will sink into the bottom, right?
Yes, sir.
The best swimmer will be on the top layer. Okay? You understand? So I'm not telling you that you are wrong or confusion. I'm giving you, my tone is like that only because I'm giving you the power of the words there. A patient may specifically request a chaperone, or in certain circumstances we will nominate one, but it will not always be the case. Case by case basis. Is that clear there itself?
Yes. Okay, sir.
In the first sentence itself, it is there, right?
Yes.
And in certain cases, a chaperone is required or not. Not always be the case. Sometimes the cases demand a chaperone. Sometimes the cases do not demand a chaperone. You understand now? Even if the patient demands, you can reject. And even if you appoint, the patient rejects, still you can appoint. Because that is depending on professional judgment. Because patient is not the authority. The professional is the authority. You understand there?
Yes, sir.
In the first sentence itself
Understood.
is clear. No need to go to the second sentence also, right?
Yes, sir.
He already cleared you there. First word in the third line. Case. It will not always be the case of requirement of a chaperone. Required means needed. In the first line itself, it is there. Case means according to the case you have to. That means case by case basis. Is that clear?
Yes, sir.
First line itself is the answer, right?
Yes, sir.
And still, if you don't understand in the first line, go to the second line, still it is there. Small children will get confused. So if you go to the bottom, you'll get more and more confused. Okay,
Yes, sir.
right. Fine, it depends again. Not always the case. Okay, is that clear now? Aim and faith? Right. Jamal Khan, very nicely explained. Thank you, Jamal. Okay, now shall we move to the next question? Are you tired? Say yes or no. Are you energetic? No, I will not say, I will not use negative word. Are you energetic to handle some more questions? Say yes or no. Come on, fast. So we have done 4 questions. If you say more questions, I am with you. Come on, come on, come on. Hit the button. Hit the button. There are 15 or 13 students and only 5 yes. Okay. Come on, hit the button fast. Next. So we'll move to the question number 5. Question number 5 is coming in. Yes, there you are. Yeah, it has come in. So this is question number 5. Okay, let me give you the link. Copy post link. Once you are ready, you can go there. Okay, this is post link and this is channel link. Anyone you take. I prefer post link, not channel link. Copy message link. This is the group. Okay. Now this is the question. 2 minutes for you. Yeah. Yes. Now gets so question 5. Question 5. 5, 4, 3, 2, 1. Submit. Come on, come on, come on. Okay. Okay. Now we have got the answers. Very good. Most of them are A. So that's very clear. Right. Many students are getting the benefit of a free speaking sessions, which I'm giving. So why don't you people also join the free speaking sessions? Okay. You can join. For example, Stephalyn Thomas. So this is a new name. Okay. Sanjana is there. Okay. Reena. Then Punita, why don't you join the sessions? Manali Patel. Okay. Jamal Khan. Okay. Faiga. Divya Prabhu. Chitra is attending. Okay. So there are many regular students, but sometimes we are giving free sessions we are providing, and you can attend the sessions. There are 5 WhatsApp groups, 5 chambers, and you can join those WhatsApp groups. And there, okay, let me show you WhatsApp groups. So you can join the WhatsApp groups. Okay. So in the Telegram channel, you have WhatsApp groups. Okay, here there are WhatsApp groups. You can see here. These are the WhatsApp group role plays. Okay, practice as many sessions as you can. Okay, so these are the groups you can see here. So this is group number A with Wani. Okay, I am connecting this one. So practice with groups. The sky is the limit. Practice. Okay, speaking sessions. Okay, practice speaking sessions on a daily basis. Okay, if you just click on this one, you can go there and you can see group A, Wani, and group B with Manju, group D with Pushpa, group E with Maunika, group F with Anusha, and group Z with the Grandmaster himself. So here, this is the feedback session. This is limited mostly for the regular students, paid students. Okay. So I'll be covering them, and many free groups are there here. You can attend all these free groups. The interlocutors are there. They will not give you feedback, but they'll give you a lot of practice for fluency. You can join those sessions, all these sessions. You can join those sessions, and you can just become a member. Okay. So this is first link. I'm giving you the links here. Okay. You can just click and automatically you'll get admission there. So this is one group number 1. Okay. So next one, group number 2 is here. You can just click. Okay. You can just click on that one. Okay. Copy link. And here it is. This is the right one group. So copy link. Okay, this is another group, right? So these are the groups. You click on them and you'll directly join there. Okay, and group number D with Pushpa. Okay, copy link. Okay, there you can practice speaking sessions. Many people are enjoying those sessions. D, Pushpa. Then E, copy link Monica. I am paying them. Don't think that you are getting those things free. I am paying them. 5 people I appointed just to give free sessions for the students. Okay, right. I'm paying out of my pocket. It's not just free. Okay, you need not pay anything there, but you'll get at least some practice. Okay, right. So this is the last one. This is my group. Personally, I am handling this group, and there I'll give feedback sessions. Last one is the Grandmasters group. This is exclusively for paid students. You can join there, you can attend the sessions, and you can see how my sessions will go. I will tell you. So here I have taken a session with a doctor today. I have taken a session. Then you can go there. Okay. Now I have posted it here. All my speaking sessions. Okay, here it is. Today I have taken 8th one is Dr. Muhammad Azharuddin. So this is the speaking session. If you click on this, the audio will be playing. But what that one, that is not sufficient. That is something different. I have given you a link inside. If you go inside in the comment section, you will get author link. So click on this one anywhere. It will take you to my website, author there, and there you will hear. I'll show you how it works. Okay, this is a paid session totally. Okay, so if you want special sessions, you can register. Otherwise, I don't ask for any registration. All the other groups are free sessions. So this is right, author. So there it will take you directly, and yeah, here it is. Now what you have to do is just click on here. Azharuddin, you can start now.
Hello, I'm Dr. Muhammad. I'm the breathing doctor for today. May I confirm your name and relation with the child?
Doctor, I am the mother of this child, 10-month-old boy. I have come to see you.
Okay.
My boy is suffering from gastro, some problem. I don't exactly understand this one. So can you explain me?
Okay. Yeah, definitely I'll do that. But before we begin, I would like to know a bit more about your child. Since how long, what exactly he has, whether he hasn't, whether he's throwing up, whether he has a diarrhea, loose watery stools, what exactly? Could you please describe a bit more about it?
Yeah, okay. Okay, fine. Okay. So tell me, doctor, what do you want to tell me? What you want me to tell you?
Like whether he had, what he has been going through all those days, like whether he had any loose watery diarrhea, whether he showed up,
Okay.
whether he had any fever.
Okay, fine. So now let us see here. Yeah, my son suffering from gastroenteritis. He becoming very worried. I am becoming very worried about the child. He has had diarrhea for the last 24 hours. So 8 to 10 times in that period, and has also vomited twice. He is urinating regularly but is crying more than usual. He has a fever and is coughing. He has apparent soreness in the nappy area.
Okay, so I could gather what information you have told me. It seems that he is suffering from
Now this is
gastroenteritis, what you said.
the
It's an
speaking
infection
session
of the
finished.
bowel.
Yes.
You can
Yes, doctor. Of course.
Yeah, I continue with the breastfeeding because that is also a kind of hydration. he will be well hydrated if he receives a good amount of milk. So you can continue with the breastfeeding, and you can also give what all semi-solid food what he's taking at home, you can also give it. And nothing else, nothing apart from that, special food or something. You need to concentrate on his hydration, make him good, drink more of water, liquids. That's all you have to do.
Okay, doctor.
Okay, now I'm going to give the feedback. What are the corrections? What are the mistakes? Everything I'll give him. You see here.
That's really very nice of
Is
you.
there?
Thank you very much, doctor.
Thank you.
Okay, now what I want to tell you is the flow is getting disrupted at times. Sometimes in the middle, it's getting stuck, and afterwards you're following it up. But what I want you to do is you practice more sessions like this, and you can maintain the fluency. You're doing well, but avoid using active voice as far as possible. Again, in the speaking also, don't think that speaking is different from writing. In speaking also, passive voice is more valuable, because you will be avoiding unnecessarily that you, I will recommend you, I want to recommend these things to you, you need not bother about all these things. So all these active voice sentences, unnecessary things will be eliminated. The subject will come to priority. So for example, excellent feeding habits are recommended. Daily regular consumption of fluids is advised, like that. So however you do in the writing, the same things you can do in the speaking also. I suggest you to give, all these things are not necessary. So regular consumption of fluids is recommended, like that. So try to use passive voice as far as possible, and qualitative sentences you can do, and you can try to increase your vocabulary style, and you can even the quality, the range of vocabulary from B1, B2 to C1, C2 vocabulary you can take. What are C1, C2 vocabulary you can study, and you can implement them in your speaking sessions. Is that clear?
Okay, sir.
Okay, so you were
Okay, so I think you got an idea about what I was doing here. This is fine. This is my site. So I have registered for that, and all these things are available in the website. Yes. So sign with Google. Yeah, this is mine. Okay. So now what I do is all the regular students, mostly of regular students who have registered with my sessions, they have their logs here. They can go through them. They can study others also. There are hundreds and thousands of audios here. So you can see here. Okay. Right. So my conversations. So here it is, Dr. Muhammad Azharuddin just now was. Here there is Gaijin Shano. She just attended. Okay. She's a new student. And then this is her speech. One more I am giving you. So
Gaijin Shano. Okay, Gaijin.
sorry. Yeah, here it is. Okay. Right.
Gaijin Shano. Okay, Gaijin, you can start now.
Okay. Good evening.
Good evening, nurse.
Please be seated.
Yeah, speak a little loudly, please.
Okay, sir. Good evening.
Good evening, nurse.
Please be seated.
Yeah, thank you very much.
You look so anxious. May I know the reason behind?
Yeah, nurse, look here. I have come with my 6-year-old son. Yeah, let me introduce myself to you. My name is Margaret Thatcher, and you can call me Maggie, and this is my son Charles. Okay, now look at this. My son has just cut a finger on his right hand with a kitchen knife. I actually
Okay.
happened to leave it on the kitchen bench, and you see the finger won't stop bleeding, and I'm panicking about it. Nurse,
Yeah.
my son
Yeah.
is afraid of doctors, and I have to weigh this consideration against my concern about his finger. Nurse, doesn't the cut look deep?
Please allow me to. Yeah, your question is really valid, and there will be a little scar because this little bone, little cut skin has gone. So there will be little scar, but there is no. It will not remain for a long time, and he may have to take rest for 1 week till the wound is clean. After that, he will come to normal life.
Okay, okay, nurse. And what more can I do regarding my son's condition? How can I improve, minimize it?
Yeah, just you have to keep in mind that you should not. Thank you very much, and you have to observe the wound for any bleeding or any unusual signs. If you notice that, you have to reach to doctor medical. Okay.
Okay, nurse.
Thank you very much.
So here is the
will
feedback
work
which
on
I
it
have
very
given for
thoroughly.
her.
Yes, nurse. Thank you once again. Okay, now let me give you feedback regarding your present speaking session. Actually, you're speaking well, but that's not sufficient. You have to practice more and more. So every day practice 5 or 6 sessions like this, and that will definitely help you. Otherwise, because lack of practice will land you into problems, and suddenly you'll get stuck and you will not be used. That confidence level will go down. So daily you practice like this, okay?
Okay, sir.
And after practicing like this, then you come to me. If you really want the sessions on a regular basis with me, okay, then you have to contact me personally and tell me your problems. Then I'll see what I can do for you. But otherwise, you can. Now you are speaking very well. Fluency is well maintained. Accuracy, there is a little bit problem, but you have to use some sort of style. You have to create a style of your own, gauge into style. Okay, don't speak like every normal person speaks. You have to speak in a very special way. That is always better for you. Then next one, what you can do is you can practice more speaking sessions. Whenever there is a chance, practice more and more speaking sessions so that you will get more confident. That is what I suggest for you. And then what more you can do is I am giving a lot of feedback sessions in the Telegram channel, and I am giving explanation also. If, for example, I am going to tell you some sentences, those sentences you can take from the Telegram channel. Everyone, I'll give like this feedback. There I'll tell 3 or 4 sentences, different ones. You go there, collect everything, and use them in your own speaking session. For example, you could have spoken like this. For example, I believe that you are a busy employee in addition to being a mother. So therefore, you do not have much time to spend with the children. Of course, I agree with you. But the thing is, children should be taken care of properly, round the clock, all the 24 hours a day. So if any care is not taken and somebody is not there to monitor, they may land up into such problems. And this, luckily, is nothing happened, not that much problem, but to avoid any complicated situations, for example, heavy bleeding or hurting, cutting the veins, or poking into the eyes, okay, it may be a serious problem. Then afterwards he may become blind or something. So care should be taken. Prevention is better than cure. So that is why what I suggest you is, if you are not in a position to monitor or supervise your child round the clock, what you can do is you can arrange a babysitter for you, or you can send him to a nursery where a person can be watching them every time. Regular supervision is there so that they will not land into trouble. So this is the way how you can speak. Is that clear, Genjin?
Okay, so here you have seen number of examples I have given, so you can practice them. So that is a bonus point for you. You can practice those sessions also. So that will help you a lot. Right. Now coming to our point. Yes. So the last question. Yeah. So the last question. So somebody is telling, so they want, right? See here. Okay. HM Hakmoas from Pakistan, Dhaka. Okay, right. So the next question is question number 6. So I'm sending question number 6 to you. Is there. Question number 5 is done. Okay, did we explain the question number 5? Wait a minute. No, we did not get the explanation. Okay. So fine. 1 minute. Let me give the explanation first. Okay. So explanation to this question. Right. Now let us see this question here. Right. Okay. Now, the guidelines require those under clinical medication review too. Okay. So, answers are done. This is 5th question. Yes. 5th question is here. Most of you have given A. Right. So, the guidelines require those undertaking a clinical medication review too. So, what is required here? So, now let us see. The guidelines require means need. Remember the words always. Require those undertaking a clinical medication review to do what? To do what? So in the review, clinical medication review, to do what? So, right. So who is undertaking? The guidelines require those undertaking a clinical medication review too. So, involve the patient in their decisions. So involvement of patient. So patient's involvement. So involvement. Consider the cost. Recommend other services and alternative medication, alternative to medication. So other services, alternative services, that is what it is. Recommend other services, alternate services. So now here, so is it involving the patient, or is it cost of treatments, or is it services alternative? So which is important here? Now let us see that one very clearly. So, right. Now let us see, always you see in the middle I told you. So 1, 2, 3. Okay, leave those. 1, 2, 3, leave this. So 1, 2, leave. 1, 2, leave. So in the middle you see here, however is there here, that's all. Catch it up. Catch it up. However is a twister. However is a twister. So there is a very clear picture. Now you got the word however here. However, the guidelines go on to say, the guidelines go on to say, the guidelines are telling what? That all patients should have the chance to raise questions and highlight problems about their medicines. That's it. All the patients. So it is related to patients, not related to cost. Should have the chance to raise questions. That means they should be involved. So that's it. So from here, directly you are going to the center. There are some people who don't have patience. I told you a lot of examples I'm going to give you. So they're busy, of course, we know. So, yeah, double line, black. Okay. So here, however is the twister here. Okay, it is modifying. Right. Have a chance to raise questions. Have a chance. That means they are involved. Who are involved? All the patients. All the patients are involved. The patients in their decisions. Raise questions and highlight problems about their medications, and that any changes result from the review and agreed with the patients. Agreed means decisions. That means they are ready to take decisions. Agreed with the patient. So patient's decision is very important. Involvement, not only involvement, decision of the patient is very important. If he is not interested, for example, you want to give insulin injections and the patient is not ready, I don't want insulin injection, you have to tell them. But if he does not accept, then we cannot do anything. Okay. See, for example, sometimes, there are injections and capsules. For example, some medications are given as capsules, some medications are given as injections intravenously. So then what happens? The patient says, I don't want injections, I am afraid of injections, so don't give me injections, give me medications, that's all. So you have to listen to him. So they should be agreed with the patient. If patient agrees, then only you are going to agreed. Agree is related to decisions, remember, and this is related to patients, and all the patients in their decisions, majority of all the patients, their decisions, patients in their decisions, plural, everything is there. Everything is there. See here. So that is how you have to go forward. Okay. Is that clear? Is that clear? Good night, beta. Is that clear? If it is clear, say yes. Oh. 1, 2. So most of people are tired, I think. Okay, no problem. I will also be tired. If you don't want to respond, I will also be tired. Actually, my energy goes up and up and up. Okay, right. Fine. So we got yes. So we can move ahead. Any doubts? No doubts. Okay, we can move ahead now. I floating meeting. Nana Raja. కొద్దిగా గ్రీన్ టీ చేసి ఇస్తానన్నా ప్లీజ్ ఓపిక ఉందా ఓకే నన్న ఐ విల్ డూ ఇట్ ఫర్ మై సెల్ఫ్ నో ప్రాబ్లం ఇట్స్ ఓకే 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 రైట్ సో నౌ దిస్ ఇస్ ద print screen. Okay. That is the explanation for 5th question. Now, who is this Anjana? Okay. So, right. Clear drawings. Right. That's it. Now I'm sending the next set of questions. So 6th question. Yeah. 6th questions are in. Yes. 6th questions are in. Yeah, here it is, sixth question. Okay, it will be very clear. Don't worry. 1 second, copy, sorry, post link. Yeah, this link is here. Okay. Patel. Okay, so that is the link for channel, and this is the link for group. So anywhere you will get, once you learn the answer, you can go there and click on A or B or C. So there it is. Okay. 2 minutes. Don't write the answer here now. Okay, I have given the connection. There you have to go and write. Only when I tell you to write, you have to write here, please. Okay. Right. 2 minutes up. And we are here. So question 6, Q6. Okay. 5, 4, 3, 2, 1. Submit your response. Yeah. So now let us see the explanation for this question. Yeah. Now the purpose. What is the purpose of this email? What is the purpose of this email? Purpose. This is an email we can understand. And what is the purpose? Purpose means a subject. You should know that. So simple as that. Purpose means the subject. And the subject is safe use. That means opioid should be used safely. Okay. That means earlier it was unsafe. So now they want to make it safe. There itself it is understood. Earlier not safe. Now it is, they want to make it safe. If everything is safe, why do they want to make it safe? It is unsafe. So that's why it is safety is needed. See, for example, the screw is loose. So tighten it. So if it is loose only, if it is not tight, then you have to make it tight. Okay. So, so this is the how. This is the way how you will follow. The box is heavy. That means reduce the weight. Remove some things from the box. We cannot carry it. That's the problem. So there is something is there. Subject is safe use of opioids. Why safe use of opioids? That means there are chances that it is unsafe. Earlier it was unsafe, so now they want safe. So that's why it is giving, they are sending a mail. Okay, now let us see. It's an alert. That means warning. Alert means warning, alarm, alert, warning. Okay, now let us see here. Now safe use, safety. Remember, now here you go here. Report on a rise in post-surgical complication. Rise, increased complications. Increased post-surgical complications. Right. Explain the background to a change in patient care. Explain the background to a change. So background, explain the background to a change in the patient care. Change, some modification, change is happening here. Remind staff about procedures. Remind staff about procedures. This is talking about procedures. This is talking about background story. Okay. Procedures for drugs. Background for change. Rise in problems. So complications, number 1. Background, number 2. Procedures, number 3. Now let us see very carefully. Okay. So here itself the answer is there. Advisory, it will safe use of opioids. Early it was unsafe, so now they want safe. So this is already pointing me directly to change from unsafe to safe. You have to read between the lines. You have to read between the lines. From unsafe to safe is a change. Earlier background was unsafe background. Now present background is safe background. So that's it. So explaining the change in the background. Earlier the conditions or the background or the situations were not good. They were not safe. So that's why they are demanding for safety. So change from unsafe to safety conditions. That is what it is. In the first line itself, subject is the purpose. That there only you'll get the answer. If you are clever enough, if you are wise enough, you'll get in the beginning only. But if you're not so wise like a doctorate student, wise doesn't mean that we are foolish. Wise doesn't mean that I am foolish. Wisdom has levels. Knowledge has levels. A 5th class student has 5th class knowledge. A 10th class student has 10th class knowledge. A postgraduate student has postgraduate knowledge. And a PhD candidate has PhD knowledge. So you cannot compare a 5th class student with a postgraduate student or a PhD candidate. So that depends on your knowledge. So your level. If you can find the answer here, that means you are going to get a grade. That means 450 score you will get if you can get the answer. If you have the knowledge from the beginning itself, in the first part itself, you can find the answer. That means you are very, very knowledgeable. Okay, extremely knowledgeable. But if you get in the last part, that means you are a high school student. Okay, you are a high school. So the twister is here. Here the twister is subject. Subject means purpose. Subject means purpose. And this is safe use is taking here. And from the beginning itself, you are finding the answer. Then it is therefore. Therefore is the marker, twister. Therefore means because of that. That is the reason why. That is the reason why. Why means question. Question will take you there to the purpose here. Recommended that post-operative patients now have continuous monitoring. Now means present and before. Past and present. Before it is past, now it is present. Have continuous monitoring instead of spot checks of both oxygenation and ventilation. Instead of spot checks means hourly checks or week hourly checks or daily checks or 12-hourly checks. So spot checks we call. They come, check and go, that's all. But now they have continuous monitoring. That means now and before. Before it was spot checks, now they have continuous monitoring. Here you think that it is easy, it is difficult, but the answers are not straightforward. Okay. Now here. So change from past to present. Past, it was spot checks. And now continuous monitoring. Earlier only 6 hours one time or 12 hours one time. But now it is continuous. So that is the change. So the hidden is there here. Change from past, this is past to present. Past to present. Earlier it was spot checks. Now it is continuous monitoring. So this is the change from spot checks to continuous monitoring. And this is related to patient. Okay. Post-operative patients. So this is related to patient. And this is check. Check means care, taking care of. You are checking him means you are taking care of him. Okay. So there is a change in the way how you are taking. Okay. So in the last it is there, in the beginning also it is there. You can see here very carefully. Okay. It's there from the beginning to the ending. I hope you understand. So postgraduate student can understand from here and a 10th class student can understand from here. That is the level of knowledge. So here it is. Is the okay. Understood. Say yes or no. Say yes or say no. Say right. So that's it. So total out of 6 questions. So total score out of 6 questions. Now, what is your score? What is your score? If you are written only 4, then write 3 by 4 or 2 by 3 or 6 by 6 like that. Yeah, Chitra wrote 4 by 6. Good. What about the others? Bharati 5 by 6. Manali Patel 3 by 6. Punita Frank in all 5 by 6. Mitha 5 by 6. What about the rest? 1, 2, 3, 4, 5. Okay. What about the rest? Fine. Now let us see. I'm giving a chance to unmute for everyone. Don't unmute until I name you. Bharati. So you can write 2 by 2, Jasmine Shiba.
Hello, sir.
Yeah, Bharati. Yeah, can you share your experience? How was your experience here?
Today is my third day class from you, sir. I was waiting for your B part session. Today you conducted. I'm really happy to see that, and I have learned how to solve the questions.
Okay. Was that beneficial for you?
Yes, sir. Definitely, sir.
Okay. Do you think that I am whiling away your
Yes,
time or
sir.
wasting your time, or was it necessary?
No, sir. Not like that.
Okay. So one or two different types of angles. Many people they just say this is the answer. Some directions they'll give and leave it, but we are going to coin each and everything. Okay.
Yes, sir.
Yes. Chitra. Hello, Chitra.
Good evening, sir.
Good evening, Chitra. How are you?
Fine, sir.
More than your first name, I like the second name, Chitra Kalyana Sundaram. Okay.
Yes, sir. Yes, sir.
Okay, fine. Share your experience. How was the session today?
Section is very nice, sir. I am understanding so many techniques also. Before that, I am elimination method only. I know, sir. So now I am understand then other techniques also, sir.
Okay, okay. So fine. Do you wish to recommend more sessions like this for your friends?
Yes, sir.
Okay, fine. Do you want to take 1 hour and 20 questions, or 2 questions and 20 minutes? Which is better you feel?
20 minutes, sir. 1 hour if you are taking 20 questions is better because we know a lot of knowledge about the wordings and understanding the meaning. So everything, it is useful for to find out some other question answer also, sir.
Definitely. That's good. That's good. Next, Manali.
Thank you, sir. Thank you.
Yes, sir.
Hello, Manali. Where are you from? Kulu, Manali?
No, sir. I'm from Ahmedabad.
Ahmedabad, Gujarat?
Yes.
Okay, Gujarati.
Yes,
Yeah.
sir.
Tell me, Manali, what did you learn today? Was that beneficial for you?
Oh, yes, sir. Actually, I attend your class just first time, and I just starting preparing. I am beginner, and this is really beneficial for me. I am when I do reading that time I'm scared like how I can do this. But after this session, I feel like I can do this.
Okay, fine. So next
Okay,
is
sir.
yeah, Manali.
Thank you. Yes,
Okay.
sir. Are you taking this lecture daily basis on the daily
For
basis?
regular students, I'm taking on a daily basis. Weekly once I'll give open sessions.
Okay.
Regular
So
students means who
is
register the
there
course with me.
okay?
For we
And
have two types of courses, long term and one monthly. So long term courses are for 100 days. Monthly courses are for 1 month. So you can, if you are interested, then you
okay,
can
sir.
contact me personally later.
Okay, sir.
And you have my number.
Okay,
Do you
thank
have
you.
my number?
Oh, yes, sir.
You have my number. Okay. The person who dropped this message is mine. Okay. Next one.
Yes, sir.
Jasmine Shiba.
Good evening, sir.
Hello, good evening, Jasmine. How are you?
Fine, thank you. Sir, actually, this is for my first platform, this one. First time I am attending here. Today I have learned this new technique. This is first time I am learning this new technique. It's very good for me.
Okay, where are you from, Jasmine?
I'm from Tamil Nadu.
Tamil Nadu. Okay. Okay, good. Fine.
At present, I am staying in Oman.
You are present staying in Oman. Okay.
Yeah.
Okay. Good. Okay. Next one, Mitha. Hello, Mitha.
Good evening, sir.
Good evening, Mitha.
Yes.
Yeah. What did you learn today?
Really, your class is really very much good. Till yesterday, I was like, I need to read one passage 3 times, 4 times, then
Oh
I'll
my
get
God.
the answer. Yes.
Okay.
And
I'm sorry to hear that.
what you taught in yesterday, I gone and watch in YouTube, and later I tried that same technique, and I in one trial only I got the answer.
Wow. Very good. Very good.
Yeah.
You have to give me
So I
some
was
time.
waited for your link so that I
Ah,
can join this class.
okay. Okay.
Okay, thank you so much for
Fine.
the class
Fine.
what you are
Welcome.
taking.
Welcome. Punita. Hello, Punita.
Good evening, sir.
Good evening, Punita. How are you? Long time afterwards.
Yeah, sir, I am not feeling well actually.
Why you are not feeling well?
I got pneumonia and also that
Ayyo.
um,
Ayyo.
now also I feel like coughing. Bronchitis is still.
Okay. Okay. We'll keep you in
Sorry.
prayers. We'll
Sorry.
keep you in prayers. Okay.
Yes, sir. It's really great, sir. It's really beneficial for me. Before and all, I used to use that elimination techniques. Now I came to know these other techniques also. Now I am following, but 3 months I am not at all studied. I am not all anything.
Okay. Okay. Relax. Relax. Don't
Okay, sir. Okay,
hurt yourself.
okay,
Okay,
sir.
then we'll
Thank you,
meet.
sir.
We'll meet again with the next session. Have a nice day. Bye bye.
Bye-bye, sir. Thank you, sir.
Okay.
Yes, thank you, sir.
Okay. Good night.
Good night, sir.